Now, the rising cost of health care. The American Medical Association says spending on health care has taken its biggest jump in 2 decades, with the exception of the pandemic year of 2020. The AMA says health care spending in 2023 was up 7.5%, nearly double the overall inflation rate. Nonprofit hospitals get a tax exemption for giving low-income patients free or discounted care. But CBS News has found hundreds of those hospitals are suing patients who cannot pay their bills. Here is Ash-har Quraishi.
You are a honeybee.
6 years ago, before starting her family, Alexis Lewis worked 2 jobs to put herself through nursing school. The last thing she needed, a medical bill after a night in the hospital for trouble breathing.
And you didn't have insurance at the time?
No.
How much was it for?
$6,500, I believe.
Did you have the money?
No, of course not.
It shouldn't have mattered because she'd gone to a nonprofit hospital, the University of Tennessee Medical Center in Knoxville. According to its own policy, a single person making less than $52,000 a year, like Lewis, may qualify for financial assistance known as charity care, something she didn't know.
And at no point were you ever told by the hospital that you might be eligible for some sort of financial assistance to pay off this debt?
Never.
After Lewis missed payments and the hospital couldn't contact her, its collection agency sued, and she ended up in this courtroom. A judge ordered deductions from her paychecks go toward her debt. Lewis is not alone. CBS News found in 1 year, more than 400 nonprofit hospitals nationwide used debt collection tactics and lawsuits, trying to collect more than $800 million from patients who should have qualified for charity care.
It is immoral to sue patients who cannot afford their bills as a tax-exempt hospital.
Eli Rushbanks is an attorney for the nonprofit $4, which helps patients access charity care. He says the root of the problem is knowledge. Patients aren't aware financial help exists, so they don't apply for it. He points to many different reasons, including hospital terminology that's confusing to patients.
They don't understand terminology like financial assistance or charity care because those terms don't really mean anything. They think that it's a payment plan or something.
Nonprofits are required to provide that information on paper and online, display it publicly in the hospital, and include it in your bill. It's up to patients to read that information and then apply. But one state's solution puts the onus on hospitals. Oregon requires them to proactively screen all patients and give financial assistance to those who qualify. 6 years later, Alexis Lewis is still paying off her bill, $150 a month. UT Medical Center wouldn't respond to our questions about why she wasn't offered charity care, but says its policies are designed to ensure that eligible patients have access to the care they need.
So, Usher, do people have any recourse here?
Well, look, it's tough. Depending on the state that you live in, reach out to an advocacy group that can help you navigate the process and see what, you can do to try and deal with this. Oregon, for example, requires nonprofit hospitals that charge patients who should have received charity care a refund if they do charge them. And there are a number of states that are looking to strengthen laws to better protect consumers.
And read the fine print, too.
Absolutely.
Ash-har Quraishi, thank you.